Hi everyone, we're Group 7 and we chose flaccid dysarthria as our topic. But before we go into what flaccid dysarthria is, we're going to give you an overview of dysarthria. Dysarthria is a partial or complete disruption in the ability to communicate due to neuromuscular impairments. There are 7 types. There's flaccid, spastic, unilateral upper motor neuron, ataxic, hypokinetic, and hyperkinetic has quick and slow. They're categorized in 3 ways. Paralytic is the complete or partial loss of function for a specific muscle or group of muscles. Coordination affects the muscle tone, strength, rate of speech, and articulatory precision that the patient's ability to coordinate motor speech acts is impaired. And then movement is unwanted and defective speech movements, which can occur slowly and rapidly. The 3 paralytic dysarthrias are flaccid, spastic, and unilateral upper motor neuron. There's 1 coordination, and it's ataxic. And then there's 2 movement, which are hypokinetic and hyperkinetic.
And then the definition of flaccid dysarthria is a neurological voice disorder of the lower motor neuron system, which is also known as the final common pathway. The lower motor neuron system has 4 components. It's the cell body and its dendrites, axon, the myoneural junction, and muscle fibers. And there are several causes of flaccid dysarthria, and many diseases and disorders can damage the lower motor neuron system in any one of the 4 components. According to Haynes and Penzola, flaccid dysarthrias result from disorders or lesions of the lower motor neuron system, and the muscle movement problem may be progressive or may affect the bulbar motor units. Some specific diseases or disorders that can cause damage to the lower motor neuron system is trauma, surgery, stroke, tumor, infection, degenerative diseases, and muscular diseases. It may also be caused by damage to nerves that emerge from the brainstem or the spinal cord and travel directly to muscles that are involved in speech production. These are primarily cranial nerves 5, which is the trigeminal, 10, which is vagus, and 12, which is hypoglossal.
Okay, I'm going to be talking a little bit about the symptoms of flaccid dysarthria, and some of these include diminished reflexes, hypotonia, which is decreased muscle tone, muscle weakness, and atrophy are common symptoms of flaccid dysarthria. Damage to the trigeminal nerves, vagus, and hypoglossal. These primarily result in flaccid dysarthria as well. The symptoms depend on the motor speech process affected, and these include respiration, phonation, articulation, resonancy, and prosody. For example, when the respiratory motor speech process is affected in flaccid dysarthria, the patient is likely to have reduced vital capacity. Reduced respiratory support for speech production results in an impaired control and reduced loudness. Associated features of flaccid dysarthria include muscle fasciculation, this is twitching, and also drooling.
And I researched a few ways that treatment is done for flaccid dysarthria. I came up with about 8 or 9 of them. It was generally about 8 or 9 different categories that they do treatment in. Those categories are oral motor, which consists of lips, jaw, and tongue, respiratory, phonation, prosody, velopharyngeal resonance, and sometimes people have more than just those categories. For oral motor, though, the point is to discuss anatomy and how the weakness occurs to the client, but in this time you'll use visual feedback with a mirror where the patient can see everything that they're doing with their mouth. The point is to increase reps and endurance and also strength. And for jaw muscle, the point is to teach initial steps for opening and closing the mouth. Bite blocks are used, and the ultimate goal is to strengthen closure. For lips, they do things such as pursing and retracting the lips, smiling, frowning, rounding the lips, spreading the lips, lip opening and closing, and just any movement that you can get the client to do without using their jaw. For tongue treatment, flexing the tip of the tongue, the mid-tongue, and the posterior is often used. Protrusion of the tongue. Different exercises, there are isotonic exercises and there's isometric exercises. The isotonic exercises are repetitive movements without any resistance, and the isometric movements, exercises are movements that are made against resistance. So a lot of times a blade or a tongue depressor is used to work on a particular side of the tongue. As far as respiratory weakness treatment, it's used to increase and control the exhaled air and strengthen and coordinate muscles. So you work on postural adjustments, whether that be getting the client to sit up straight, keep the head aligned. Sometimes this means the client needs to lay flat on their back. And one of the main things that's used for that is something called the 5 for 5, which is where a wet or dry manometer is used. And the patient needs to raise the bar 5 centimeters and hold it there for 5 seconds, which is the minimum amount of air that's generally used to phonate. For phonation treatment, holding the breath and head turning is often used as it strengthens vocal cords. For residents, modifications in speech, increased loudness, reduced rate, and velar strengthening is also used. And the point is also to educate clients to listen and try to differentiate for hypernasality. For velopharyngeal, it's used to improve closure, and the method they use is often getting the client to blow and alternating oral and nasal consonants. And then for prosody treatment, you use intonation drills, pitch range exercises, and you teach how to breathe on natural pauses.
All right, and so now we have some questions for you. The first question is name 3 types of dysarthria. Okay, I guess the answer is spastic, flaccid, and hypokinetic. Our next question is, what is flaccid dysarthria a disorder of?
It's a disorder of the lower motor neuron system, which is also known as the final common pathway.
Our third question is, name 2 symptoms of flaccid dysarthria.
2 symptoms would be diminished reflexes and muscle weakness.
And our final question is, describe one of the treatments for flaccid dysarthria.
One of the treatments for flaccid dysarthria would be oral motor, and that would be to use visual feedback in any oral exercises that you use.
All right, and now we're going to show you our triboard.
Here we got the title at the top, and then over here is the definition of dysarthria, the 7 types of dysarthria, the way dysarthrias are categorized. A little bit more. There you go. The causes of flaccid dysarthria in the middle, next to the symptoms of flaccid dysarthria, and then on the final side is treatment of flaccid dysarthria, and then our references are down at the bottom.